Our dear viewers, please welcome to Masaka School of Nursing and Health Sciences Skills Center. I'm Sister Nakanjako Fatuma. Today, I'm going to take you through inserting a nasogastric tube. Remember to like, share, subscribe, and hit that notification button for more of our videos. I'm going to take you through inserting a nasogastric tube. Inserting a nasogastric tube is a procedure of introducing a tube through the nose into the stomach for many purposes. Purposes of inserting a nasogastric tube: one is to feed a patient in case oral intake is impossible. Another purpose may be correcting gastric juices in case of diagnosis. Removing poisons in case someone has swallowed some. In case a patient has obstruction in the neck and oral intake is impossible. Most times, patients who are unconscious need food and medications and they are not able to take orally. So a nasogastric tube is very essential in order to help such patients. Now, today I have prepared a variety of equipment to be used in this procedure. Here is my tray, having a bowl containing warm water where we put our tube to soften it before insertion, because if a tube is not soft, it can irritate a patient's nostrils and the way where it is passing. So it is better you soften in order not to cause irritation. I have two nasogastric tubes of different sizes for insertion and to change one in case one is faulty or is having problem. Guide pots of swabs for cleaning the sides. We have a lubricant. This lubricates the tube when inserting for easier passage. We have normal saline to act as a solution for our tube when cleaning. A bowl containing a cup of feeds in case a tube is to feed the patient. Gloves for protection. Orange sticks to clean the nostrils before insertion. I have 2 syringes, 10 ml syringes. This to correct aspirates or stomach contents when testing for position, whether the position has been reached. I have a container of litmus paper. These are to be used to test the pH of stomach content in order for us to be sure that we are in position. Receiver for use the swabs and use the gloves. I have dressing Macintosh to protect the patient's beddings. Remember, when you're carrying out this procedure, as you're cleaning the patient, some solutions may splash the patient's beddings and you contaminate. So it is better to protect the patient's pillow and cover it with a towel to prevent wetting it and contaminating it. I still have a Macintosh cape. This is put at the patient's neck region and it is also accompanied with a towel to protect and make the patient comfortable while performing the procedure. Then I have sides. Remember, this procedure sometimes it makes the patient discomfort. We need privacy so that others are not seeing, and hand washing to prevent infections. Allow me start the procedure. The first step is I have to make my patient aware as to why I'm going to carry out the procedure, and it is done this way. Good afternoon. I'm Nakanjako Fatuma. I have come to insert a tube through your nose into your stomach so that I can help you get feeds and medication. Here is my assistant. Please be comfortable. The procedure is not painful and you'll be okay. Excuse me. Let us protect the patient. Now, the patient is put in a semi-recumbent position in case the condition allows. But if your patient is unconscious, is put in a semi-prone position. Our patient can be positioned in a semi-recumbent position. This means you put the patient in a semi-seated position, semi-seated, like this. Now, we are going to protect the bed, as we said, using a dressing Macintosh. I'm adding the patient's towel to protect our beddings. Then, I'm going to tie down the top beddings up to around this level so that I can have the side seam. I'm applying a Macintosh cape, then I accompany it with a dressing Macintosh so that the patient gets comfortable. The next step is to wash hands because you need to protect infections like this. This is how we wash hands. Can be done in a routine way. When your hands are washed, ensure to dry them properly in order for you to put on the gloves well. As you do this, the assistant also gets instructed. We are protecting, excuse me, sir. We are coming to work on this. This is called creating rapport, reassuring the patient in order the patient's anxiety is allayed. Now, we are going to the center of the procedure. Here we are. When you're inserting the tube, we start by measuring the distance of insertion. The distance is measured using a nasal gastric tube. From the nose, like here, then to the cheek, over the ear, then move down to the sternum. When you reach the sternum, you mark the distance from where I started from and put a mark. That is a distance we need to use as we inserting the tube. The next thing is to lubricate our tube using KY jelly. This is called KY jelly. It is a lubricant helping the tube to get softened, and as it is being inserted, it moves properly. You instruct your patient to hyperextend the neck like this, and then assess. Observe the nostrils. So for that you can choose the best nostril to use. I'm inspecting the nostrils. Now, using a swab, I clean the patient's nostrils in a circular motion to remove secretions and to prevent infections. Now, some lubricants are put on a piece of gauze, and 1 to 2 inches of this tube is lubricated. After that, I instruct my patient to be steady as I start the procedure. Now, I insert the tube using a downward-backward movement as I instruct the patient to swallow. As the patient swallows, this creates a patent way through the nostrils, the oropharynx, into the esophagus until when I reach the stomach. Then downward and backward. Please swallow, 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 as you observe the patient's reaction toward the procedure. When the distance measured is reached, is the mark, that is when the mark reaches the nasal outlet. Then I instruct my assistant to give me a piece of nasal, the syringe. Syringe. You open the spigot. Aspirate some stomacal contents to ensure that you are in position. Now, we have many ways of ensuring whether you are in the position. The position, I mean the stomach, because it is where we want our tube to reach, because we want to feed the patient. The first method is to aspirate using a syringe. You attach the syringe to the end of the tube and aspirate. Then some stomachal content will come along the tube into the syringe. That is one step to show you. Another method, we can use a bowl containing water. The end of tube is immersed in the bowl, and when bubbles form in this water, it indicates that you are in a wrong way. It means bubble formation, you are in a trachea. But if there is no bubble forms, it means that you are in right position, that is the stomach. Another method to show you that you are in the right position is getting a syringe, withdraw some air, attach it to the end of the tube, and then auscultate. Auscultation means listening using a stethoscope. That means I will inject air into my tube as well as I listen to the left hypochondriacal region of the abdomen so that I can listen. If you hear bubbles or sounds made in the stomach, it means that the tube reached into the stomach. Those are the methods on how we assess using. Then, after withdrawing, we test the pH of the stomacal contents using a blue litmus paper. We say that stomacal contents are acidic. How do you confirm that? Is by testing using a blue litmus paper. Drop some aspirates, and when they turn a litmus paper, the blue litmus red, it means that you corrected the right specimen, that is the gastric juice, and you are in a right track. After inserting, then we shall get a tape and secure the tube at the patient's cheek. Spigot it well in order to prevent air entrance into the stomach. I'm securing the tube because even if the patient makes movements, the tube will remain in the position. After securing my tube, the procedure is done. If you were to provide feeds, you continue by adding a feeding funnel or syringe, and then give out feeds. After that, you ask for the patient's reaction. How do you feel? Are you comfortable with that tube? If you get any discomfort, you alert us and we help you. I clear away, that is by removing whatever I have used in order to leave my patient comfortable. You cover the patient well. Thank the patient, thank you for adhering to the procedure. Then I clear away. Remove the gloves. And then lastly, I wash hands. My dear viewers, that has been the session of inserting a nasal gastric tube. Remember to like, share and subscribe and hit the notification button for more of our videos. I remain Nakanjako Fatuma, Masaka School of Nursing and Health Sciences. Bye-bye.